This is how people-centered, resilient health systems are implemented at the community level. Like many countries in the world today, Thailand has progressed into fully being an aged society, with over 14% of its population being seniors over the age of 65. With this transition comes the challenges of providing medical care to the significant proportion of elderly citizens in the country, many needing long-term care until their final days to ensure their dignified aging. The reality acknowledged by Thai public agencies like the National Health Security Office, or NHSO, is that addressing the challenges of an aged society is not the task of any single body, that the solution to dignified aging and providing healthcare to seniors is multi-sectoral. One of the most fundamental challenges for the elderly in acquiring healthcare is that of access. Whether due to location, physical ability, or time, being able to conveniently receive health services is immensely important to people of advanced age. Ladsawai Medical Center is a prime example of how community-based healthcare, realized through multi-sectoral cooperation and integration, can effectively elevate access to medical treatment for senior citizens.
ในมอตโต้หรือว่าเป็นภาพที่เราอยากให้ประชาชนได้รับเนาะ
The term multi-sectoral refers to how we have partners and allies. The NHSO motto is that we want citizens to access the services they are entitled. The service they receive should meet standards and have quality. The NHSO is focused on benefits. When it comes to actual service, however, the office cannot do this itself. That is why we need partners. It is important we have strategic partnerships. Service providers are our partners. There are a diverse range of service providers, from hospitals to local medical centers. There are also partners for the management of funds. NHSO funds can be combined with local government funds by matching funds. That makes funding available to citizens through the administrations close to them. Requests can be made to support activities for health promotion and disease prevention or rehabilitation. Caregiving can be done by hospitals, health centers, or even health service unit, which work with the NHSO.
Ladsawai Municipality Medical Center is the direct result of integrative collaboration between different agencies serving public health.
Ladsawai Medical Center is a response to how, when we seek service at public hospitals, it's not very convenient. They have to handle an oversupply of patients. I had the opportunity to receive service at the Bueng Yi To Medical Center. The service there is very good, and the public response has been that it is good. Wait times are short. You receive service as soon as you arrive. The center handles quite a large number of patients, but the service is still excellent.
Ladsawai Medical Center was established with the objective of as closely matching the services of a private medical facility as possible, meaning it offers a range of needed treatments with both speed and quality.
ในส่วนของศูนย์การแพทย์เทศบาลเมืองลาดสวายของเราเป็นหน่วยบริการปฐมภูมินะคะ
Ladsawai Municipal Medical Center is a primary care facility. We provide service here at the center, as well as proactively within the community. At the center, we treat general conditions and chronic conditions. We have family doctors and general surgeons. 2 to 3 physicians are available here each day. They make general diagnoses, tend to chronic illnesses, operate on abscesses, and tend or stitch wounds. General care is provided here at the center. There are also dental services here. We have 3 dentists in service each day. There is a physical therapy clinic that carries our rehabilitation of patients. Thai and Chinese medical treatments are available. These are provided at the center. In terms of prevention promotion, we mostly act within the community. We serve residents to maintain their good health. Moreover, we provide long-term care. For health rehabilitation, interdisciplinary teams visit patients at home. For long-term care, care managers create individual care plans for caregivers. They then go to patient homes. This is so that all our community members, including those who are bedridden, receive care.
Built on multi-sectoral integration and extending the reach of Ladsawai Medical Center, volunteer caregivers join the center's personnel in meeting with patients and performing needed treatments on them in their homes within the community. The community-based rehabilitation units of the program are especially important. They aid bedridden patients or those seniors who have a limited capability to travel, whether due to their physical condition or the availability of caretakers. Just as important as providing medical treatments is health promotion and disease prevention, or PP. These activities, carried out by Ladsawai Medical Center personnel and physicians, as well as volunteers and caregivers, provide advice and guidance to community members on how to minimize ailments. Importantly, the results at Ladsawai Medical Center speak for themselves. Senior citizens in need of medical care, whether long-term, at home, or just on a regular basis, now have convenient access to it within their community. Matched funds from the NHSO and local government funds are part of long-term care implementation at the community level, as well as multidisciplinary team services. This is the result of multi-sectoral cooperation.
The moment you walk in, it's a good experience. The staff greet you and speak to you. They ask how you're doing, and they welcome you to receive service. They check your cards and all of that. The guidance they give is very good. The staff at the counter here are very welcoming. After being served here, I realized the care is very good. I no longer have to go to the public hospitals, which can be far. From my house to here is just a short distance.
Bedridden patients, or those with no mobility, are served by an ambulance. You just to register for it before you come. They come to pick you up and bring you to Ladsawai Medical Center. Here, we receive physical therapy, and they change his urine bag. The technology here at Ladsawai Medical Center has improved my husband's recovery. At home, we can only perform therapy manually. Here, there is the standing bed and rails to assist walking. His sense of touch is returning because we have come often.
Expanding to more locations throughout Thailand, the blueprint established by Ladsawai Medical Center in collaboration with public health agencies such as the Ministry of Public Health, the academic sector, local governments, and the NHSO is one not just for how to operate a community medical center,